Hello friends, myself Dr. Ruchika Garg. Today I will be telling you whether you can have a normal vaginal delivery after cesarean section. So it depends upon so many things. Let your gynecologist decide it. But you should know certain facts that first of all you should have a lower segment cesarean section. So if you have a classical cesarean section, that means the incision, the cut has been made in the upper part of the uterus, then it is not possible to have a further vaginal delivery because the upper segment incision, if it is there, if it is a classical cesarean section, then there are chances of rupture of uterus in the subsequent pregnancy and the chances are quite high. Moreover, if the lower segment, that is the lower part of the uterus, if you have got cesarean section, you should preferably have a transverse incision. That means not a vertical or a standing incision, it should be a horizontal incision, because with the horizontal incision in the uterus, the chances of rupture of the uterus and the dehiscence of the scar, that is the scar giving way, is less. So if you have a vertical or a straight incision in the uterus, that too in the lower part, the chances of rupture are comparatively more. So there are other factors also. So don't get confused with the abdominal incision, that is incision on the skin. So the skin incision can be a vertical incision or it could be a transverse or a phalansteal incision. We are talking about the incision in the uterus. So if you are planning for a vaginal delivery after a cesarean section, we call it a VBAC, vaginal birth after cesarean section. You can go for a trial of labor, but your center should be well equipped with an experienced obstetrician, and the facility for anesthesia is available. Neonatologist should be available, neonatal care should be available. And if at any time the doctor feels that your scar is giving way, they will take you straight for the cesarean section if they feel that there is a scar tenderness. During the antenatal period also, we assess the thickness of the scar. So it should be preferably 5 mm or more, then we can go for a trial of labor, and you should have a sufficient time before the 2 pregnancies. And now coming to the number of cesarean sections. So trial of labor or a vaginal birth can be tried after only up to 2 cesarean sections, but preferably only after we prefer to do a normal vaginal birth after only 1 cesarean section, because the chances of rupture of the uterus or the scar giving way, the scar dehiscence, is more with 2 cesarean section. So when the patient is in the labor, during the labor pains, with the uterine contractions, the scar may give way and it may lead to scar dehiscence or slight dehiscence or even rupture of uterus. So if there is a rupture of uterus, the fetus may come into the peritoneal cavity and it will lose the placenta will lose its attachment from the uterine wall, and it will stop receiving oxygen and the nutrients, and there may be fetal death. So we have to be very cautious. The doctor has to judiciously assess whether this patient can be taken for a vaginal birth and at what time she has to be shifted during the trial of labor also for the cesarean section. So fetal heart rate monitoring by means of a cardiotocograph and CTG is very essentially required, because if there is a ruptured uterus, then the fetal heart rate is the first thing to drop. Then there are other signs and symptoms which your obstetrician will assess. So don't be afraid. Regularly have your checkup with the obstetrician. So, but why do we prefer for a vaginal birth? So there are advantages and disadvantages of both a repeat cesarean section and a trial of vaginal birth. So what are the dangers with a repeat elective cesarean section? So if the number of cesarean sections are increased in the subsequent cesarean sections, it becomes quite challenging, because there may be adhesions of the bladder, that is your urine pouch, or adhesions of the bowel, and in general it's surgically difficult. Then the patient may require more blood transfusions, and there are chances that the placenta may be low lying, or placenta will come into the lower segment. The placenta is implanted, which is called as a placenta previa. So placenta previa is a risky condition in which the patient may land up into fresh vaginal bleeding, and that too severe vaginal bleeding, and so that's quite scary. And there could be also placenta accreta. That means normally there is a plane of separation between the uterus and the placenta, but in placenta accreta, in cases of the incidence is more in cases with more number of cesarean section. As the number of cesarean births increase, the incidence of placenta accreta increases. So there is no plane of dissection between the placenta and the uterus, so it is difficult to separate the placenta. In such case, the patient may land up into severe hemorrhage. So we are not able to separate the placenta, and even the placenta may penetrate into the urinary bladder, that is urine pouch, and so complicated surgery it becomes, and it causes severe morbidity and mortality of the mother, and she may require even hysterectomy. So if we have diagnosed that it's a case of placenta accreta beforehand by means of a color Doppler ultrasound, so after delivering the baby we might have to go for a elective cesarean hysterectomy without any attempt to separate the placenta, because if we attempt to separate the placenta, as there is no plane of cleavage, it may lead to torrential and severe bleeding. Then the patient may require so many blood transfusions. And as we know that with cesarean section, there's chance of wound infection, subsequent hernia formation, the morbidity, the convalescence period is quite more. She will take more time to return to her daily activities. Moreover, the child care is delayed, and with a normal vaginal birth, there is definitely a risk of the dehiscence of the scar, which could be risky for both the mother as well as the fetus. But the normal vaginal delivery has its own advantages, that the patient convalescence period is less, she has less number of surgeries, less chances of placenta previa, less chances of placenta accreta, and so it's safe for the mother as well. And so there are less adhesions because normal vaginal birth is there. So don't be afraid. Take care. Bye bye.